Morning. How is everybody?
We're all good.
Good.
Lovely to see everybody again, even if they are postage stamp size.
I seem to be freezing as well.
It seems to be the theme of the morning. There's already been conversations about blankets, hot water bottles, jumpers. And good morning, Alison. Thank you for joining us. We will be underway in a moment. Right, Marie is just in the process of letting people in. So as people come in, do write in the chat, tell us who you are. It's always good to see everyone and know who's here. Always fantastic to have representation across the sectors. You know, welcome to those of you from ICBs. Welcome to those of you from local authorities and education services. Welcome to parents and carers who are joining us, and those from voluntary agencies. Very big welcome to all our speakers this morning and our selection of DSCOs and DCOs. You see, there has to be a dance attached to that. There really does. Come on. So yeah, so good to see them coming in, and yes, excellent. And Daisy, you'd be worried if we didn't have CDC services joining us, wouldn't you? But here they are, they're coming in. So that's great. Excellent. I was saying as you were joining, folks, that I missed the physical conferences, but I have to say for these conferences, we get such a big regional spread, which is brilliant. Yeah. So it does make it easier in that sense. Okay, right. You're all still coming in. Please write a new thing. What I'd say to anybody as well who doesn't believe we can work jointly is they ought to just look at the invite list for this and the people coming in. This real mix of people from health, education and care. A DCO for physical health, that's an interesting one in South Gloucestershire.
The team is growing.
Indeed, indeed.
We've got deputy DCOs, we've got DCOs.
Newly...
Soon we'll have Uber DCOs or DHOs, depending on which way it goes, won't we? So should we get going, Christine, given it's 3 minutes past?
I've still got a housekeeping slide up. I was thinking that somebody might magically move it on.
Oh, I don't have a housekeeping slide.
I know, polling and workshops, which is an appropriate time to start as people are coming in. So good morning, everyone. Thank you very much for joining us today. My name is Christine Lenihan, and I am the Director of the Council for Disabled Children, and very, very pleased to welcome you today. So our theme today is what works in SEND. So partly this is because we're doing a programme on it, but partly because one of the things I think that worries us is there is so much noise in the sector about what isn't working and what is going wrong that we're in danger of forgetting that there is some excellent practice out there that's developing, some really good work going on, and some real progress work that we can share, because sometimes we get ourselves into a cycle of believing that positive change isn't possible. And at CDC, we are incredibly lucky because part of our remit is to look at positive change and work alongside you to develop it. So we have our usual format today. So for this morning, we have a number of speakers. I am delighted that Alison Ismael from the DFE is joining us. Alison is the new Director for SEND and Alternative Provision at DFE, and she's going to give us some national updates as we move forward in a time that has been confusing and rather challenging, but I'm sure she'll make sense of us for it. We've then got a really good session on sector-led improvement. And I'm really pleased we're joined by both Sally from the DFE, but a number of local authorities working on sector-led improvement and a number of advisors. They'll introduce themselves when they get here, but it's really good to have that local representation so we have a real understanding of practice on the ground. And then Amanda and Anna will be talking to us about the What Work and Send programme that we're looking at, and the recent workforce survey. So what you have asked for, where you are, and reflecting that back to you this morning. We'll then have a break and workshops. If you have not got a workshop, not sure what workshop you're in, don't know about it, all things workshops are down to Adiba. And Adiba is about, miraculously somewhere, to put her email address in the chat. So if you sat there wondering about your workshop and wondering which one you signed up for, etc., then you will see, hopefully, I'm watching it, Adiba's, there she is, Adiba's email. So any concerns about workshops, please email Adiba now. And she will sort you out for the workshops that will start at 12 o'clock or so. Okay. The other things that we are doing this morning is the polls. You have seen them now come up on your screen. They are ones we've been doing quite a lot over the years. So access the polling, use your smartphone, put that into the code. Yeah. Can't use the poll, use the chat. 2 questions. What is keeping you awake at night? Please don't write my partner's snoring. We would like issues in relation to this part of practice. I can think of a few. And also, what do you think the biggest issue is for families right now? So it would be good. So if you can put the polls in, then they will miraculously transform and we can show you the results when we get there. How long are they open for, Marie? You'll tell me. There she is.
We're just showing them now.
Here they come
You
up,
can
the
see
send
screen.
review. Yeah, I think there's a few people being kept awake by that one. Workforce challenges and Putin. Yeah. EAC plans. Workload. Nobody's written electric bills yet, so that's progress. Training, yeah. We can really see some themes here, folks, can't we? Workforce and money. I'm hoping that when Alison talks to you in a bit, she'll stop you being kept awake by the send review. Capacity, yeah. So the medical needs in schools is interesting. I'd be interested if you think it's changing. You know, it's always been an issue. We've been part of the Health in Schools Alliance or whatever it's called for years and years as those things are coming in. But be good if you're putting that up and you think it's challenging, do write me something in the chat. Come on, the impossibility of change. By the end of this morning, you're going to believe it's possible. Clinical intervention, yeah, workload. That's an interesting one. There's always a tribunals one somewhere. All right, more schools asking health to fund one-to-ones. That's an interesting one, Natasha. Yeah. Oh, thanks, Daisy.
Should we move on to the next one, Christine? We can share these results with
Yeah, that's
with everybody afterwards, but we are getting close to the wire on time.
There are some really strong themes, aren't there, in terms of workforce capacity, funding, and just people feeling slightly overwhelmed. Yeah, lack of trust for families. Yeah. Okay. Yeah. Yeah. It's not a straightforward system, isn't it? If you're a family trying to access support. Yeah, navigating support information. Schools. Settings got for training. Non-statutory role in new ICB. Hopefully we can pick that one up. I know we've also got Lorraine, as always, very, very helpfully in today's conference. Waiting list, yeah. Okay. Not surprisingly, a lot of what's keeping you awake is also what's worrying families. Yeah, the one about falling between mental health, neurodevelopmental, physical services, one that's very hot at CDC at the moment. As we look at these children that seem to cross over boundaries but don't quite fit anywhere, and where their needs need a multiple range of interventions. Okay, thank you for that. So I think what we'll do is we will send you, as part of the pack that you'll see posted after this, that somebody else will explain, what the full details of the polls and what's there and whatever. But I think we got a really strong feel for the issues that are out there for both you and families. So let's move on. I am really pleased to welcome Alison. Thank you, Alison, for joining us this morning. And I will hand over to you. So welcome to your first CDC National Conference. All these conferences, of course, are supported and paid for by the DFE, and we're always really pleased to have DFE speakers here. So welcome, Alison. Come and tell the world about you and how you'd like to update us on the national picture this morning.
Thank you so much, Christine. Can everyone hear me okay? Well, thank you so much for inviting me to join you this morning. I have to say, I knew it was a big cast list and a wide representation, but when you were all introducing yourself in the chat, I was thinking this is quite an intimidating cast list. It's an all-star cast from every area, but it's also a really good opportunity to get to meet lots of you in one go. So I'm really pleased to be here. And I have to say, before I forget, that I'd like to thank Christine especially, because ever since I started in my post last month, she's been incredibly supportive and patient with me on all fronts. So it's nice to be attending an event you're leading, Christine. I also have to say, before I get started, I thought that quick poll event we just did was, full of rich insights. It was, as you said, that a lot of your answers to both questions were quite similar. But Marie, I wonder whether it's possible afterwards just to get a quick download of those slides so that I can take them back to the team. And there's obviously lots of serious and strong stuff there, but I did slightly chortle to myself, Christine, when you introduced it and said the thing about the partner snoring, because actually my partner doesn't snore, but I was lucky enough to go away for the weekend. This weekend just gone with my oldest friend from school. I've known her more than 30 years, and she is such a great person, very poised, very glamorous job, really elegant, very chic and everything. But oh my goodness, it turns out after 30 years, she snores like a pneumatic drill. So I had the best weekend ever, but in a sofa bed that was literally shaking through this wonderful lady's snoring. So it made me laugh that was the example you gave us not to give on the poll. So what I thought I would do today, I've got a few slides which we can work through, but I'll just do really quick introduction to myself, if that's all right, since I haven't had the opportunity to meet most of you so far. And then just a little bit of context on what's been happening at DFE over the last few weeks, when we've seen, really quite a bit of change just in the very recent period, and the dust is settling, I guess, if you like, on a few of those changes. And then I know that some of this will be more familiar already to some of you than others, but I thought I'd take the opportunity just to remind us about where we are following the SEND review in the summer, and what we can expect in terms of next steps. So I've got a few slides that I'll speak to, and then if there's a bit of time before the next session for discussion, then that'll be fantastic. So to introduce myself, I'm Alison Ismael. As Christine says, I joined last month on the 15th of August to be DFE Director for Special Educational Needs and Alternative Provision. And I'm absolutely thrilled to be here, quite daunted obviously, but it's a real pleasure and a privilege to be picking up this role. Most recently, before coming to DfE, I worked at DEFRA, the Department for the Environment, Food and Rural Affairs, where I had responsibility for what we call agri-food, which is basically food and farming. So that was quite a sort of stretching period, dealing with food supply and things like that during EU exit and COVID. But before that, the overwhelming majority of my career has been in the health and education space, and particularly children and young people. So I actually began my career in what was then the Department for Education and Skills, many, many years ago, under quite a different government. And has had some fantastic roles here. Also had a long period in and around the Department of Health and Social Care, working on things like health inequalities, maternity policy, patient redress, clinical negligence. I had a fantastic period when I was on secondment for a couple of years to an NHS trust working on their local children's health programme. And in that period as well, I had my own kids and one's about to be 10, the other one's 12. So you can imagine how excited I was to have the opportunity to come to DfE, back to DfE, depending on how you look at it, to pick up this role, which is obviously incredibly motivating. And I've already had the chance to meet and talk to some fantastic people. So that's me, and I'm very happy to pick up with you separately and hopefully meet lots of you in different opportunities to get to know you more and introduce myself a bit more. Coming into what's been happening at the Department for Education, we've obviously had a period of a lot of change. In fact, an amount of change that I don't think I could have imagined. So we obviously knew that there would be a new Prime Minister at the beginning of September, and that it might well be that then a fairly significant ministerial reshuffle followed from that. I know that it's the team I've picked up at DfE and my colleagues here have really felt the effect of having several different education secretaries over the past year, in fact, even the past months. We're ready for some more stability, to say the least, and that's obviously true even more of everyone in the wider system. So we had that very strange week of September the 5th. We obviously had a new Secretary of State arrive, Kit Malthouse, and a new ministerial team, including Kellie Tolhurst as Minister of State. And right around the time that was happening, obviously, very sadly, we had the death of Her Majesty the Queen. And I don't think I could have imagined a situation in which we had a change of Prime Minister and a change of Head of State within 48 hours of each other. But that was obviously the very strange and quite sad timing of it. And obviously, all of you in your local areas will have been affected by response to the death of the Queen and the mourning period and everything. But the reason I'm stressing the point a bit is just because it has meant it's taken a little bit longer for things like ministerial responsibilities to be ironed out, and for our new ministers who are incredibly keen to get going, to get into that sort of outward-facing element of their role, because obviously it wasn't appropriate for them to be out doing a lot of visits and things like that during the mourning period. So that's just a little bit of context about the sort of turbulence, if you like, that we've seen across government, and the hope now that things will be settling down a little with ministers in their new post. So I'll just say a little bit about these two ministers who are particularly important for the SEND and alternative provision systems. And I know, Christine, you've obviously had the chance of some introductions with them as well, and others may have done as well. So it's not, I don't want to set myself up as the only source of information on them. But we've got Secretary of State Kit Malthouse, and he likes to be called Kit, so everyone's had to train themselves out of the habit of calling him Secretary of State. And he, I think, is absolutely thrilled to be here, really, really highly motivated to be picking up the education system and all the responsibilities that come alongside it. He's had quite a varied ministerial career, including at the Home Office, where I think that's given him a lot of real motivation for looking at how we support and help some of the most families in some of the most challenging circumstances. and sort of challenging communities. He has also been part of the London regional government. He's got, I think, 3 kids himself. And so far I've in introductory meetings and sending advice to him, I've found him very engaged, very keen to listen, asking some very acute questions. As I say, he's just starting to do visits. He visited last week a PRU in York, which I know he found really rewarding, and really enjoyed talking to the young people there. So that's Kit, Secretary of State. And then also really important for us is Kellie Tolhurst, who is Minister of State, is the deputy, if you like, the Secretary of State. And she's picked up responsibility. It's a very, very wide and kind of, I think, motivating portfolio for her. So lead on most school stuff, but also special educational needs and alternative provision, and a range of sort of other really important issues that come together with that focus, reflected in the fact that she's the sort of second most senior minister for the department. Also children's social care is within her remit, which is a really important area of kind of joint focus for her, if you like. And she's already talked to me and my team, and I think talked to you, Christine, about how we better understand the overlap and the interrelationships between the SEND and the children's social care systems, and in particular what that means in practice for those actually responsible for them in our local areas. So that is Kellie, yeah, I'd agree with all those adjectives you put in the chat, Christine, to describe her. So obviously it's the beginning of the relationship, but she is really energetic, really keen to understand how she can make a difference. Very, very keen to understand the causes of some of the issues that we need to deal with, as well as just the challenges themselves. And I hope that we can be getting her out really soon to do some more visits and to meet more of you, because she's hugely enthusiastic for that. So that is a little bit about the ministerial team. If we go to slide 4. I'm just going to mention a little bit about the SEND review. Obviously, SEND review got a couple of mentions in those polls earlier, and I know that some of you will be really familiar with this already, but I'm just going to speak briefly to these headlines here, just to make sure we're on the same page. So the SEND review, also known as the SEND Green Paper, which I still find a little bit confusing, was published in May, and it was a joint publication between the Department for Education and Department of Health, and colleagues here working with many of you and really wide stakeholder group, including Christine, began with this sort of problem diagnosis about the key challenges that we hear from everybody that need to be addressed in the system. So again, you know, these won't be new to you, but I'll touch on them briefly. The first one is about outcomes, which I think, you know, can sound like it's a little bit of a dry sort of technical word, but obviously what that really means is the life chances and what we can offer to children and young people with SEND. And unfortunately, we know that consistently by most measures, almost all measures, in fact, they're worse than for their peers who don't have SEND, and that's something that obviously by anyone's measure needs urgently addressing. Second one, and obviously it's related to outcomes, but it's a bit different as well, is about experience. So we know that this isn't just children and young people themselves, but their families as well. It's obviously something that was, again, borne out in your poll responses. Often find that despite the provisions that came in the 2014 Children and Families Act, they find the navigation of the system to be poor, and they have stressful experiences, and that sense of an adversarial system of having to fight to get what they need, and then so that's that really strong element, not just about outcome, but about experience. So another point about inconsistency across the country. So we know that decisions about support are very often have more a relationship to where that child or young person happens to live, rather than a look at their actual needs and what's best for them. And I mean, this is one where I'm really looking forward to getting under the skin of what this really means in practice with lots of you, because I think the conclusion here is that we do need more of a national system, but it's about how do you get that balance right with local decision making. And I think that's something that's very, very easy to say, but much harder to make it work, get that balance right in practice. And then the last one is about value for money, which is obviously, you know, it's a clunky and not very attractive phrase in some ways, but we know that despite huge investment in the system, it doesn't feel that way often to the people who receive those services, commission those services, deliver those services. And we certainly haven't seen an improvement in outcomes or experience in any way to match that investment. So that is the fourth kind of broad problem that was identified in the SEND review. If we go to slide 5, I'm going to speed up a bit here because I know we're a little bit tight on time. These are the 5 kind of headlines about the improved system that we set out in the Green Paper. So the first one is about that national system for SEND and AP. And I think that is actually a significant change from the emphasis on local delivery and decision making. Again, it's all about balance. It's about the yin and yang and how you get that right. But we are proposing to have clear national standards based on evidence of what works for children and young people, with that very clear focus from birth through to 25. I think that leads very much on to the second point, which is about capacity and mainstream education. So obviously it isn't all about mainstream, but we know that that is where the vast majority of children with SEND are. It absolutely should be the case that all those working in those settings have the knowledge and the skills they need to provide for and look after those children and young people. And that we can take a really good look at what the best setting is for children and young people, recognising that for most families a sort of local mainstream offer may often be the best thing. That said, the third one, and obviously flows on from that, is about appropriate and affordable specialist provision for those who do need it, and that includes alternative provision. As a slight aside, it's been interesting in some of these introductory meetings trying to define for new ministers how these different categories fit together, and it makes you realise how we get used to these terms. And actually, if you step back and try and explain specialist provision, alternative provision, and are they different? Are they in some cases the same? It's not always a very, very crystal clear way of capturing it in a few words. But that is obviously a third really important part of the improved system that we're proposing, and with that emphasis on quality and wherever possible close to that child or young person's home. Fourth one, and I have to tell you, I'm not quick enough to follow all the chat as it goes through, but I can see that this point about accountability is coming through. But the fourth one is about clear roles, strength and accountability, and the reform of funding so that all partners in the system have clear roles and responsibilities in line with consistent expectations at national level, and that there's a clear way to hold them to account for delivery of them. And the fifth one is, you know, shorthand is delivering change for children and families, but to me this one is really about stabilisation. So, you know, it's all very well and it's quite right to talk about reform, but actually we know that many local areas are in a really difficult position already. Unfortunately, global events are exacerbating that, whether you look at the availability of workforce, the cost of workforce, for example, the energy crisis. And so there's a real thing there about just stabilisation to create that baseline that we can then improve from. I will go on to slide 6. So just to mention the consultation which was running over the summer after publication. There was a huge sort of outreach around consultation, which I know many of you will have been involved in, and help us just to really bring in as many views as possible. So there was over 175 events held, which we think reached over 4,500 people. They covered a really broad range of sectors, so not just schools, but also specific outreach to parents and carers, local government, children and young people themselves, the post-16 sector, the voluntary sector, and really important health and social care. And we received over 6,000 responses. So some of those are obviously from individuals, such as young children, young people themselves, parents and carers, many from organisations. So there's obviously, an incredible richness but also complexity of feedback there. So slide 7, I'll quickly just bring out a few key points that have come through from the feedback. And when I was preparing to move over from Bedford to DFE, my team here sent me these massive PDFs, summarising all the feedback from these different areas. And it was a really good way to just get my understanding of what the views on our proposals were, even though I think it crashed my old email account, but that was fine. It says here, and I think this is correct, that there's broad consensus that in broad terms our problem diagnosis is the correct one. Obviously, what we need to get under the skin of is what that means in practice and the texture and the nuance and lighter shade around that. So what we've found is that the vast majority of respondents really welcome the focus on inclusion, but they want greater clarity about what that actually means in practice. So the question of how schools are going to be held accountable, and in particular, the schools white paper came out within a couple of days of our green paper. So what's the interrelationship there and how's that going to work in practice? There's big consensus around the importance of the workforce to our reforms. And this picks up the point about mainstream, but actually for all educational settings, school leaders and all staff ought to have a working and refreshed understanding of the needs of children and young people with SEND. Then there's a point about system capacity, and I think that's the point I've referred to about challenges across the sector already before you get to the point of being able to consider reform. It's a point about cumulative reforms, and obviously I think the real thing there about the interrelationship with children's social care, for example, and how much can be done at the same time or sequentially. And then final point is about stability and accountability. And I think the whole system approach, recognising that for children and families, it's their life is a single life. They don't think in terms of those narrow vertical pillars of how government might historically operate. But I do think the point about health and social care there and the interrelationship is like that for me is an absolutely key one. So in terms of what's next, this is the final slide, and I've been referring to my slide numbers, but on this pack it's 12. We've got captured here a few things that are underway already to support the national system. So that is things like investment into short breaks, it's supported internships, it's our investment and support programme for local authorities, especially those with financial deficits. But on next steps, we're still working at great pace to analyse, consolidate, test all that very extensive feedback that I've referred to. We've obviously got new ministers in place now, and obviously it's not just about DFE ministers, it's also hugely important to health ministers, Department of Work and Pension ministers, and the centre of government, and I have to say also the Treasury, to test out what our next steps could be, really taking into account that point about sequencing, about the sensible order to do things in, our plan is to publish follow-up to the SEND review before the end of this calendar year to set out our response to everything we've heard through the consultation and the next steps. So that is all underway at pace. As I say, it's always going to be a winding and challenging road, but I'm very hopeful now that if we have stability in our ministerial team, that will help us working with all of you to make progress here. And continuing to engage with our partners across the system, like all of you, has got to be an absolutely key part of that. So I'll just finish by saying thank you for having me here today and for this slot, and obviously for everything you do in your areas and your organisations. I think we know it's not going to be easy, but I hope this engagement will always be really valuable, and I'm really looking forward to working with all of you.
Thank you very much, Alison. That was really helpful. You will have seen, or you will see, a sort of range of things going on in the chat, and we will make sure these chat comments come to you so you can get a feel of people's issues and where they are.
That would be great, because I've managed to follow a few of them, but most of them have been going a bit fast for me. So maybe I can get them separately and then digest them afterwards.
Yeah, absolutely. There is it's one of the things I've had to learn is how to chair and look at a chat that needs moves at speed. Somebody's got their hand up. I did see the name, but it moved across. Was it Tony Marie?
Yeah.
If you're there, would you like to ask a question, please? Make sure you're not on mute. Okay. Not coming through.
Sorry,
All right.
I think I clicked the wrong button.
That's all right. Give us your question now then, Tony
No,
Marie.
I think I clicked the wrong button, put my hand up. I was doing
Oh,
the
that's it.
informed.
No,
I don't
that's
have a
fine.
question, I apologise.
No, that's fine. That's very, very easily done. I suppose lots and lots of detail coming through on the chat, Alison, about, for example, short breaks and what's going on. And I suppose what would be helpful is if you can reflect back to us about the conversations you're having with your health colleagues. We have a lot of health colleagues on the meeting today, and I think they're feeling a bit left out. But I know that you talk to health regularly, so if you just want to reflect that back, that would be very helpful.
I will. Christine, can I have like just 30 more seconds to say something about health?
Please do.
Really quickly, yeah. So, I mean, I can see those comments about health coming through, and I will obviously take all of this back to health colleagues, and that's the Department of Health and Social Care, but also NHS England. Yeah. I think this is, to me, like one of the absolute key things here is the health and education interface, if you like, not forgetting the importance of social care for lots of families. And it's one where I really hope that I'll be able to draw on some of what I've learned kind of in other roles I've held in and around the health system. I think there's always something that's really difficult for us, which is about trying to clear time and space in that national health discussion to think about these sort of really, really important issues. And although, you know, it's incredibly important to be thinking about acute care and cancer and COPD and all those sort of things that often will generate headlines, thinking about big hospitals and that sort of thing. It's almost every role I've had, there's been a key element, which is just about how do you get that focus about join up, local health, community health, population health, prevention, early intervention. And this is almost like we have to constantly be finding new ways to remind about the importance of that when it comes to funding, when it comes to public debate, and to really just constantly be thinking about how can we get that join up and not be thinking, I know it's a cliche, but in that vertical way. I can see all these points going through super fast, but you know, it seems to me like completely right and not at all surprising, and lots of you would be raising that. So I just wanted to say that I've heard it loud and clear.
And according to the chat, you're meeting with Lorraine and Sue on Monday next week.
I am looking forward to that.
So that's very helpful.
Yeah.
Okay, yeah, and I think just on those of you asking about the short break stuff, we are delighted, as always, to be working with the DFE and those local authorities that are working on the short break innovation programme. And we met them last week for our first community of practice. Most of them are working on work in relation to children with ASD, SEMH, children who have behavioural challenges, and we are working to produce some information for you that you'll get quickly. So as these things develop and as we start to go on, the DFE has appointed a partner to help them work on supported internships. So as these things develop, we will make sure that those practice materials come out. So in our next conference, I'm looking hopefully at my team for, you know, reassurance. In our next conference, which I think is January, February, something like that. February, thank you. This sort of stuff will be workshops and presentations as part of that. So you'll see it as it sort of, you know, comes through and on whatever. Yeah, and thank you for those of you also talking about the links with adults. So we know that one of the big concerns in the green paper in the review was about post-16 and understanding post-16 and what was happening on post-16 and the links with adult care. And I know that that has been picked up to be developed. So I think, so what you've heard from Alison is the framework. This is how the framework works. Now it's calmed down a bit and we've got ministers and hopefully they'll last a bit longer than the last ones and things like that. So what I think is a really helpful link to now come on and look at, so what does this mean on the ground? What does improvement mean? Any review coming through, any consultation, any process is sort of medium to long term. In the meantime, as you are aware, and the things you're talking about, families and services and the people who work in them need support now. Hence the sector-led improvement programme. So we are delighted to welcome Sally and a team of colleagues from around the country who are going to talk to us about practice. So what is happening in practice on a day-to-day basis that will lead to a what works in SEND approach. So Sally, you are very welcome.
I'm not sure if we've got Sally yet, but are we slightly ahead on the agenda?
Not too bad,
we are slightly ahead on time. Christine, I wondered whether it'd be helpful if Alison is still with us. If there was a lot of heat around the comment about funding and within health and the fact that there's been this massive increase in EHC plans, which obviously has an impact for health colleagues, and obviously a lot of what DFE are doing in the education space is about trying to meet that need earlier on, yeah. and reduce the pressure or the need for parents to request an EHC plan because needs have actually been met at the point. And obviously that has different implications for health, but I just wonder whether Alison might want to say anything about that just in the few minutes while we're waiting for Sally.
Over to you, Alison, but you'll have to come off mute.
I will have to come off mute. You think I'd learn one of these days. So that's the point specifically about the upwards trend in applications for EHCP and how the funding flows.
Yeah,
well, I guess and I guess obviously DFE are very aware of the funding impacts within the high needs funding system, probably less cited on the funding impacts. Obviously, every referral for a health assessment and, then has an impact on the health workforce, which hasn't necessarily been costed into their contracts, and they're having to. So I think that's what the massive number of likes of that comment was about. People trying to cope with current levels of capacity, but significantly increased demand within the health system.
Yeah, so I mean, I think that's a really excellent point and hopefully just serves to underline everything we've been saying about the importance of really close joint working and the risks around looking at this, which we do have a risk of doing in government, I know, of sort of through a single lens. And I think to me, there's a couple of kind of broad points there. So one is about this major question that we're all thinking about the whole time, which is what really underlies that escalation in the trend towards applying for an EHCP, and the degree to which that demand can be sensitively and rightly managed by improving provision and what's available in mainstream, but equally understanding that where we do need that application for EHCP, that we're properly understanding all the knock-on impacts of that on a number of different services and workforces, and not just looking at it through a narrow lens. So there's a big thing here about, I think for me, about integration and accountability, and also it's so easy to say the word system capacity, but it's so meaningful. It's such a big issue. You can't commission what isn't there. And there's always something that we need to remind ministers of, which is that in loads of local areas, it will be the same teams dealing with all of this, sort of layered on top of each other. So it's not as simple as just saying, well, what should the process be, follow the money. But I think it's another really important point for me there, which is the one about local variation. So, one of the points that the team said to me when they were briefing me early on is that actually whether you're registered for SEN support and then whether you're put forward for EHCP is actually more to do with your local area and the school you attend than actually to do with how your level of need is presenting. So we know that local areas have very different trends and manage this quite differently. So there's a real thing there for me about using the consultation feedback, about understanding how different areas are doing this, and how we can bake some of that learning into things like national standards and clarifying accountabilities, to not respond to need, because that's crucially important and it's an entitlement, but to learn from those areas that are successfully doing early intervention in a way that manages down some of that demand and that pressure on services that may already be strained.
Thanks, Alison. It's interesting. It's created a lively chat debate, which in effect comes down for who pays for what and what do we expect, with, as always in the system, all the different parts of it suggesting that they're not the people who've got the money, somebody else has got the money, they're not quite sure what they've got, etc. So that clarity and accountability that you talked about as one of the big feedbacks from the SEND review is really important, I think. And I think I put something in the chat which said, for those of you working with areas where you think there is good shared accountability, let's build on the models, let's understand what's needed as we go forward. I can also see that Sally has joined us. Welcome, Sally. It's good to see you. So thank you, Alison. And as I said, we're now going to go on and look at the SEND sector-led improvement programme. Yes, joint commissioning indeed. And Sally will lead that, but she has a number of colleagues from around the country who joined us, and you're very welcome. So let's see now how some of the challenges that we've talked about from Alison's point of view are working out on the ground and what's going on. Sally, over to you.
Thanks, Christine. I feel like a correspondent. Hello, Sally Dyson here reporting. So my name is Sally Dyson. I work in the DFE improvement team, and we sit over slightly separately from Alison's team, who are leading on the reforms, and we're on the ground staff. So we are the forward-facing, LA-facing and NHS-facing team. And we have a presence now in regions group, as we're called. We now have a SEND presence in all 9 regions in the country. And as just trailed, I'm here today to talk to you about our sector-led improvement programme, along with the partners who are delivering said programme. So you're not going to hear too much from me. You're going to hear more from our delivery partners, who are going to talk about their different journeys and their different delivery models. But just by way of introduction, as you know, this is the department's SEND vision, and I just wanted to flash this up as usual to say we are all pulling in the same direction. So whilst my work sits in a different group to Alison's work on the reforms, we are absolutely integrated and working together towards this single vision. Next slide, please. Lovely. So we have a number of packages of support in the improvement team that are available to local areas right now, because we recognise that whilst we are working on a reform package, there are weaknesses and needs in the system right this minute, and we need to get on and make sure that that support is available to local areas right now. One of those packages is the Sector-Led Improvement Partners, or SLIPs, which has to be the world's worst acronym. I massively regret it, but there we are, the SLIP programme. Now, many of you who have experience in the children's social care sector will know that the PIP or SLIP programme in children's social care has been running for a number of years and has expanded again this year. And in the department, we've got a reasonable amount of evidence now, of the efficacy of the children's social care programme. And we've wanted for a while to roll this out in SEND. We did a pilot jointly with children's social care last year. And now we are running a SEND-specific, SEND-only sector-led improvement partner programme. That said, 3 of our partners also work on the children's social care side, and where there are opportunities to work across SEND and social care, we will absolutely take them to make sure coherence is the key. But these partners are available to work specifically on SEND services. So for those of you not in the know, what is sector-led improvement? Well, it's frankly, it's learning from the people on the ground delivering services that do it well. So this is not the department saying that we know what is best and we think that a local area with weaknesses should do X, Y, and Z. This is us turning to local authorities, local areas who we know are high performing, where we have evidence that they have strengths in certain areas, and asking them to then deliver support to local areas that have needs in said areas. It's one of our most intensive support packages. So we expect a SLIP package to be a minimum of 40 days. There is a bit of flexibility built into that if we spot opportunity where something smaller is needed. But as a general principle, it's one of our more intensive support packages. So this is for an area to get really deep in with a SLIP partner to look at something reform-led or something structural, something big within a local area. And we have 4 SEND specific SLIPs, and they are Warrington, Bedford, Islington, and Kensington, Chelsea and Westminster working together as Borough. And I'm delighted to say that we've got somebody on the call from all of those areas here to talk to you a little bit more about their offer, their journey, and their specific programme. So I thought it would be better for you to hear from them. And then we will have a little bit of time at the end for reflection. SLIP colleagues, just to say, I know there are a reasonable amount of slides in this slide deck. We have around 7 minutes each. So if you could keep it as snappy as possible, that would leave us some time for discussion at the end. So to kick us off, we have Chris Morris from Bedford. Chris will introduce himself with his specific role, and he's going to talk a little bit about Bedford's offer. Chris?
Thank you. Morning, everyone. So I'm Chris Morris. I am the Chief Officer for Education, SEND and School Infrastructure here in Bedford Borough. And previously, I was the manager for the SEND programme. So SEND programme manager brought in to work across health in our ICB, or the CCG as it was then, and the local authority. I was a joint post sort of delivering on SEND improvement. So I have colleagues who are now working into that post as well. And it wouldn't be a discussion around SEND without the word journey being at the present. And everyone always rolls their eyes when we talk about sort of the journey, but I'm still yet to think of something better as a description of actually where most of our systems have been and where we are heading towards. So just want to sort of start off with talk about us here in Bedford Borough. So we, as a settled improvement partner, are probably we're the only one who have previously had a written statement of action. So we did have a written statement of action following a February 2018 SEND inspection. We had 5 areas of weakness that we needed to work on, and we recognised that, and we talked about the fact that actually this was a really good example of inspection driving improvement. It was a wake-up call that was much needed in a system. We were doing some things well, but there were certainly some areas that we needed to improve, and we really mobilised across both our health, education and social care colleagues, and most importantly in strengthening and improving our co-production to really work hard on moving us forward in trying to drive forward those improvements that we needed to be. We were delighted to have been found to have made sufficient progress in all 5 areas in February 2020, and even more delighted to be able to be identified as one of only 4 sector-led improvement partners in the country in December 2021. So quite a steep sort of journey there of improvement, and I always feel in terms of I should fully caveat that with, and we still have lots of improvement still to go. So I know we talk about the fact that you know, high performing, obviously uncomfortably we talk about high performing, we do some things well. We definitely have some other areas that we know we need to work on, and we, you know, and I'm sure we have many parent carers who would probably agree that we've done you know, quite a lot of things well, but we also have some areas that we need to improve. Thinking about the beginning of this this presentation and the polls that happened at the beginning of this meeting, it's a complex system. It's a really complex system, and you know, and we recognise that with our support, we really want to get alongside our settled improvement partners and really walk with you and find out a bit more. So if we move the slide on to a bit more about what our offer is, so you know, perfect interface there into walking alongside. I think that's a really good way of describing what our offer is. We are not coming in to say we are the expert, do this and this works, because there is really very much a case of knowing the local system. I think local leaders in the system are, you know, and in particular parent carers and parent care reforms in their system are local experts in knowing actually what will and what won't work in their system. But we do a lot of work around actually how can we help you to think about what might work. Here's some things of what we've done. Here's some areas that we know have improved, and really giving the headspace and the time through both coaching and mentoring alongside our sector improvement partners to really think about actually what is it that's going to make make the system improve and really have the areas of focus on. A big thing that actually I think most of our areas that keep coming back is around impact and identifying kind of the so what. I think people get sick of me always sitting in the meetings and they tell me about different things. And I say, well, that's activity. So what? What difference is it actually making? You know, what's being felt on the ground? And that's sometimes the really hard thing for areas, especially areas where you might have a written statement of action or improvement notices or anything along those lines. Is sometimes you can get bogged down in the activity. What did you say you were going to do? And you really get tied into it. And actually having the time to work with us and think about actually what impact is that having? What is the things that you can pull out of that? What works? Do more of it. You know, that right at the beginning when we talk about the what works in SEND, you know, and this is the whole conversation, you know, we very much take on a sort of solution focus, find the bright spots. Why is that working in such a complex system? Why are you doing those areas that are working well? What is it about those that are working? Because sometimes, especially post-inspection, if you've got a written statement of action, all those things, it can be, you know, the temptation to almost throw a baby out with bathwater. And it's really important to make sure that actually you don't lose sight of what works. Data is a massive thing there. I love data. I don't think data doesn't tell us everything, but in terms of it certainly helps us to understand where to look. And you know, there's so much data out there, and sometimes I meet with areas that will talk about actually, well, we're really struggling to get a SEND performance dashboard or getting some sort of data in. And actually, there is lots of this stuff out there. It's about pulling it together in a way that pages in particular. We have a real strength in pulling into health data into SEND dashboards and recognizing that actually there is lots of data that is out there. It doesn't need to always be SEND specific is that term, but we can utilize and look at what's already in your system, how we can use that data, evidence what's working, and evidence areas around what needs to be improved. And obviously at the heart of everything that we'd be doing, it often gets talked about as a separate strand, but we often talk about I feel uncomfortable talking about co-production as a separate thing. Co-production is just being everything that we are doing, but both at strategic level, how are you working and engaging with your parent care reforms and beyond, how are you hearing the voices of children and young people, how are you hearing the voices of families of SEND, both at strategic, operational and individual levels of the SEND system. And each of those has its own challenges with regards to it. And, you know, there's lots of areas that get some areas right strategically we're up here, but actually on the ground parents are still feeling like their voices have been heard, or actually co-production in their individual education plan meetings or in their annual reviews is not really where we want it to be. So really helping areas to think about what does co-production truly mean, and trying to find a solution through in your local area is something that we're really strong on. And you know, we have a fantastic parent care reform who is you know, at the heartbeat of everything that we do, and their parent care outcomes framework is something that a lot of areas are really interested in how we actually make sure that our parent carers are this annual survey. We've done it for 5 years now. That's how we know. So back to the question of so what? Well, our parent carers and the 600, 700 of them who fill in the survey every single year tell us. How do we know? And that's taken a massive step in the right direction of making sure that actually we're being held accountable. Accountability was a term that was used before, and working with systems and thinking about actually how can you do something similar in your area, which actually unlocks a lot of the challenges that a lot of areas find. Next slide, please, which I think is my final slide, and I'm coming up to the end of my 7 minutes, I think. So just continuing of that, we see ourselves as a critical friend. Another thing that's really fascinating is there's often lots of activity with regards to improvement work, but actually it's always done in quite structured meetings or looking at action plans. And actually what's really important and what sometimes makes the biggest difference is just having space and time. So actually, you know, through the sector-led improvement partner work, what we want to do is facilitate that time for key area leaders to get together and not have a really structured agenda item and not really focus on things, but just talk and think about actually what is going well, what do we need to do better, what is the impact that we can work on, and really just sort of have that space and that time to move that forward. And you know, we sit and facilitate, and we've had some really fantastic outcomes already with some of the areas that we've been supporting around having that time and that headspace to think about it. We can do that through facilitated workshops. We can do seminars and group activities. We can talk about comms plans and how you work around actually get your communications out, how you get that engagement going really well. One of the things that we've really worked on is around that, how we do engage through our use of our regular newsletters, through our social media, through our local offer, how we get that back and forth, meaningful two-way, you said we did communication that enables parents and carers to feel like they are well informed without it feeling like you have to have these really regimented, structured meetings all the time, which sometimes can be derailed and feel like actually it's not the right way of moving things forward. We have project managers who can come in and actually help with regards to actually that capacity. A lot of people saying what's losing sleep, and quite often it's people trying to do really complex improvement work on top of actually keeping the boat afloat is sometimes really hard, and sometimes we can have people have to have 3 or 4 different jobs. We can come in and say, actually, we can help you to really sort of structure that and think about the project management. And we can pull in support through our parent care reform and through our ICB in not direct peer-to-peer support, but in thinking about actually how we as a system work. You'll see from my slides, I'm talking about Bedford Borough here, but we see that we've got our ICB logo, our parent care logo, our local offer logo, and all those things. Actually, we cannot change the system alone in Bedford Borough. We have to have all of our key partners. And so although the sector-led improvement is around local offer to local authority support, we pull in the fact that actually it's a system-wide response that's needed in every area to actually make the changes that are required. And we pull that into our offer as well. That's a whistle-stop tour of Bedford Borough, where we've been, and how we envisage and how we do work with our sector-led improvement partners. And I'm going to hand over now back to Sally to, I think, to the next slip partner.
Thanks, Chris. And just to reiterate from a DFE perspective, obviously there are lots of highlights there and lots of strengths that Chris has talked about Bed's offer. But I think that, one of the things that mainly attracted us to their bid was around that journey, having been through the written statement of action, green revisit process. I think there's nothing really that beats that experience of having lived it and the culture that kind of process can create, within a local area. So fantastic to have Bedford on board. Thank you, Chris, for that. You didn't do great with your 7 minutes, but you packed in a lot, so thank you. Now for something completely different, as they say. I think I'm handing over to Steve from RBKC to talk a little bit about Borough's offer and the Centre for Systemic Social Work. Steve?
Yep, that's me. I'll try to be better with my 7 minutes, I promise. Hi, everyone. So I'm Steve Comber. I'm the head of SEND Local Offer and SEN Outreach for Kensington and Chelsea and Westminster, referred to as the Borough. I'm going to talk a little bit about what our approach has been to this, the SEND slip work, following the engagement that we've had in the social care offer of slip work. So the first couple of slides, I'm really presenting on behalf of my colleague Caroline Pipe, who's the Director for Systemic Social Work, who we've been working with on the SLIP programme. So as a bit of context, really, the Kensington and Chelsea and Westminster, our children's services adopted systemic approaches as their practice model for social care in 2013. So for staff working with families and across organisations and across different sectors, systemic approaches really focus on the importance of relationships and thinking about how power and difference shapes and informs our understanding of the world and how we make sense of what we see and what we experience. So by examining the patterns that we create in relationships and communication, you can develop the skills to have greater awareness of how we can achieve shared meanings and a sense of coordination. This is the important bit, really, a sense of coordination both with families and other professionals. After adopting this approach in 2016, both boroughs were rated outstanding by Ofsted, and that achievement was repeated in 2019. So we maintained that outstanding social care inspection over that course of time. In the Ofsted reports, they referred to the systemic approaches, highlighting collaboration, transparency and respectful relationships, which I'm sure are all things that we recognise as being enormously important in the... oh, got some feedback there. Oh, has that sorted it? Yes, right, there we go. Yeah, something I think we can all see is really important in the SEND system. So, and the Centre for Systemic Social Work believes that the core aspects of systemic practice can be usefully applied in a variety of contexts. So, I mean, basically forget the social work bit. The principles can apply in all sorts of other contexts. So if we pop to the next slide. Yeah, The implementation of a SEND systemic training course was the first part of the work that we did in the SLIP programme. So the course essentially comprises 5 sessions designed to introduce key systemic ideas which relate to working in SEND contexts. The emphasis is placed on developing relationships, thinking about communication and working collaboratively. And as I say, that's not just with colleagues that we work with. It's very much about the way in which we work with families and develop those relationships and work with families. The idea is it's to support staff in developing a strengths-based, relationship-focused approach to, as I say, working with service users, colleagues and partner agencies, enable staff to interact with service users, partners productively, efficiently and facilitate positive outcomes. It also helps staff to think about the way in which they identify and manage risk collaboratively with colleagues and with families. Really importantly, it gets people thinking about power, difference and diversity and how these play a part in the way that we work with people, and assist staff in managing something I'm sure we all recognise, the emotional complexity of their day-to-day work as well, and being able to step back and reflect on that and how they work with families. So all of the sessions in the training were both taught and so they had taught components, but also practical exercises. And they were designed with our partner organisation, a partner borough that we're working with, to address the current issues relating to key aspects of practice in SEND contexts. If we flip to the next slide, I'll talk a little bit about the next bit, which is really just starting for us. So the consultation model, which is basically following the training. We've developed this following the training being delivered. It's funny that we're calling it a consultation model. I think Chris kind of touched on it a little bit. Is, you know, I'm not a consultant. I'm just someone working in the sector. We're working together to kind of identify areas that we know need development, and we've done that in partnership with the partner LA that we're working with. It's given the leadership team a real chance to think about what's important to them based on written statement of action, their local knowledge of their area, and really focus on those priorities and think about how we can work together to share our learning with them. It's also been a chance to capitalise on the energy created by the systemic training within the teams that receive that, but also begin to roll that out beyond the SEND service that have received that. So working with education, health, social care colleagues, council staff, NHS staff, but also staff from settings to begin to roll out some of that thinking. If we flip on to the next slide. So what we did is essentially we put time in to meet with senior leaders from the partnership authority we're working with to think about how we're going to use this time most effectively. So that was led really by the LA we're working with, but in discussion with colleagues from Kensington and Chelsea and Westminster to kind of guide how that might be done. We've come up with a schedule of events which are based on areas for development, and we'll support the local authority to think about those areas for development and what the next steps are for them in continuing to address the themes that they're working on. So that schedule of events included input from us throughout, and they're looking at things like launching the consultation element, which is really bringing people together and thinking about our focus areas. So accountability, co-production, education, health and care plans, working with schools and inclusive schools. But it's really about getting cross-sector people in the same room together to launch the work we were doing. Also going to be thinking about pathways, contributions to EHCPs, the communications we use and the language we use, and ensuring everyone is on the same page around that, and effective working with parent carers in the local area. I think, as Chris said, we're not coming along saying we know all the answers here. We're a critical friend and someone that can reflect on our experiences and our work in our local areas while working with colleagues in another LA that's working through some of these issues that we might have already begun to make some progress on, and we can share how we've done that. I think the key thing for me is the local context is so important. We have to defer to people in their local areas because we'll know what's worked in our area, but actually we need to understand the local context, and we also need to ensure that it's not us coming and doing to a local area. We're working together and there's ownership of people in the local area to take things forward between sessions. I think the other thing I wanted to highlight, and I think I'm up to 9 minutes now, so I'll do it very quickly, is we still need to deliver this. So this is something that we've put together. We've delivered the first session and there was a lot of energy in the room, and we feel like it's given us a really good basis for delivering some of this. But we need to kind of go through these sessions and work out what works really well, and that's going to help us refine what we do in the future. And I've put future at the bottom. I think one of the things we want to do is align this consultancy bit a little bit more with the training program in the future. So rather than something we think about at the end and we may have lost some momentum after the training, we want to work with the LA to think about what sort of themes is the training throwing up and what momentum can we build on right there and then, and kind of work alongside while the training's being developed. So yeah, that, as I say, that's a bit of a whistle stop tour on where we've got to, but also kind of what we're planning to do in the future. And I think I'll hand back now to Sally. I think we're going on to colleagues in Islington, I think.
Thanks, Steve. Yeah, and again, I meant it when I said something a little bit different. So what we wanted to do with the SLIP program is to make sure that we had a mix of offers. And I saw that somebody up in the comments had put about a mix of demographics of an LA and looking at rural LAs. That absolutely is in mind for future development. But in this first iteration of the program, we were looking at what all different bidders could potentially offer the sector. And again, this was because of the course and then the consultation model and the potential integration of the two was something a bit unique, a bit of a USP. So thanks, Steve, for running us through that. I think, Chrissy, we're going to hand over to you to tell us a little bit more about Islington. Could I said, oh, am I handing to Candy or Chrissy, one of the two? But can we try and go for 6 minutes so we have a little bit of time for discussion at the end?
Yep, shall I? It's Candy Holder here. Hi there. Shall I run with this because of the time? I think Chrissy was probably going to say a number of the things that certainly Chris has already covered about the model generally. I just wanted to really pick up on some of the things. So Candy Holder, sorry to introduce myself. Trading since 1978, so I've been in this game for a very long time. Delivered one of the very first statements of special educational needs as part of my my first role. So I've been through a number of the iterations. I can't remember your name now. It was speaking previously, but very helpfully talked about the context. I just wanted to give you a little bit of context for Islington, because absolutely that is that is key. And what do we know in a little orange bit of a bit of the country? We're a very small borough, 4 miles long, 2 miles wide. We have a borough of contrasts, very much so. You will probably only know of Islington because it's a previous home of Tony Blair and Boris Johnson, current home of Jeremy Corbyn, also current home of Michael Fagin, who was famously broke into Buckingham Palace in the 1980s and was found in the Queen's bedroom. So again, a borough of contrast, as you can see. Our journey certainly started, well before the reforms. Therefore, next slide. Thank you very much, whoever's working those. Thank you. So I wanted to start really. So one of the things I'm going to talk about is parental engagement, because that's that seems to have been a challenge in many of the certainly the local authorities that we've been working with through the SLIP program. But generally, if you look at the areas that have written statements of action or who are struggling, and so I really wanted to talk about that here, because we've. It's something we believe we do well. Certainly Ofsted thought we do well in Islington, and we've had to unpick that and think about why that is, so that we can talk to other to other places about our journey, and what are the elements of that, and to kind of really try and break it down. So I thought I'd just rehearse that with you, because this is sort of conversations that we're having with other LAs. So our journey in Islington certainly started back in the 90s, at which time in the borough, certainly we were looking to improve all of our local authority services, and there was a time of the Citizens Charter, if people can remember that far back. Part of that charter was the part of the Citizens Charter was the Charter Mark programme. So that was an award for organisations that had achieved excellence in customer services in the public sector. Basically, organisations had to demonstrate they met the principles for delivering quality public services, demonstrable evidence of customer satisfaction, and you can see the criteria on the slide there. We worked really hard in Islington through our SEND team at that time to gain this charter mark. So we were awarded that in 1996. We held it right up until I think the unit. The award was superseded or discontinued or whatever. But I think it was so important in our journey in terms of setting the right ethos for for working with families. It's about customer satisfaction. It was about the customer first, customers always right, etc., etc. So the ethos for which kind of extends it's to Islington this very day was kind of really built during that time, and I'm incredibly fortunate. If you could go to the next slide, thank you very much. In terms of our workforce and having the right people, in the right place at the right time. A lot of my staff are still people who were working with us in the 90s in the SEND team. So that ethos we've managed to carry through. I think the successive reforms and challenges that we've had. And I'm just showing you a couple of photographs here. The one on the right is our. So this was taken probably maybe about 9 or 10 years ago. So this is a group of parent champions at the time. I'm glad you recognise some of them, Christine, and I can tell you now one of those parent champions is now a speech therapist. 2 of them are now key workers in my SEND team, and one of them still sits at the front of the parent carer forum every time we meet, although her son is now 35 years old, still challenging me around all sorts of issues. But I think so I think again it's right ethos, right workforce has been kind of really critical for us. Our parent carer forum as well over the time that we've worked has been an incredibly conciliatory parent forum, and always wanted to work with us to resolve issues, and I think that again we've been blessed absolutely with that. So in a way, in terms of our journey, I think the SEND reforms we didn't think meant a great deal to us in terms of working with parents, except that we suddenly had this new word, co-production, that was introduced, and that floored us for a little while, I have to say. So we looked at the ladder, which was just on the previous slide, Arnstein's ladder of co-production. We thought, oh crikey, okay, we were almost dragging people off the streets to be part of committees and help us to co-produce this policy and that policy and everything else. And actually, it took some really brave parents from our parent carer forum to actually say to us, you know what, not everybody wants to be involved at that level. There are many different levels that we can contribute to. Some of us want information, some of us want to be more involved strategically and at a policy level. Some of us want to be involved around particular issues at particular times. So that's kind of really led us to develop our what we call our pyramid of participation in Islington, and looking at really, I suppose, engagement at different levels, at the I guess really at the level at which that people have got the time and the interest really to be joining us. So that's been a really kind of important part of our of our journey in recognizing that you can have engagement at different levels. And we've certainly got parents who've moved up and down this pyramid. We've had one of our chairs of our co-production group in the parent carer forum is currently managing our parent parliament, which is we would say is at a lower level in terms of the kind of consultation and information. So we do quick and dirty consultations. So you can move up and down, I guess, is is what we're saying there. So that's our pyramid of participation. So we talk about that to other local authorities. Next slide, thank you very much. I'm going to whiz through this. One of the things I was going to show you was a little clip of one of our parents talking about her experience of the pyramid, but we haven't really got time to look at that, unfortunately. So we'll move on to the the next slide. Again, picking up on Chris's point. So what's the what difference has that made? We've got lots of products that we've and good outcomes from our parent engagement. The one I probably am most proud of is the Send Parents Charter in Islington, which I check every time I visit any school to make sure is displayed there. And this is absolutely brought together by our parents through co-production, and every one of those parents worked together to decide what was important. And I guess the most important thing about those is not one of them costs anything. It's all about attitude, it's all about approach, it's very it's very doable, actually. The other thing that we do, we've got our parent parliament, which I've mentioned. We've also got our on our local offer our parent approved sign. So we ask parents to look at particular pages and tell us what they think. So we talk through that model with as I say, and I think when we've talked to certainly 3 other local authorities now, I think the outcome has been that they recognise they're probably doing more than that perhaps they've appreciated and necessarily understood. My final slide, I think, is to say, so is everything in the garden rosy? Again, as the 2 previous speakers have said, hell no. I would say in Islington we're part of these statistics. We've seen disputes grow, sadly. So really wanted to just say that we're certainly not saying, again, as the previous speakers have said, that it's we're perfect and we've got this right. We're still struggling, with many of the symptoms of the system, but we we keep working. My final slide is just to say that and I'm sorry I've had to blob these faces out. It's only because I didn't have time to get permission to show this picture. But this is, I think, so I've talked about ethos. I've talked about the right workforce. I think you need your pioneers as well, I suppose, is what I wanted to say. And these are 2 of the most wonderful people I could possibly tell you about. Whatever sort of practitioner I've turned out to be is as much down to these 2 as anybody. So this is, I'm going to give them not their right names, but this is Anthony, we'll say, and Sarah. So Sarah mum, Anthony's son. Anthony now 35 years old. I think Sarah was your original tiger mum. I would say, but absolutely, I learned so much about inclusion from her. I think in terms of stop trying to fit my son into one of your boxes, fit your box around my son. So I suppose my last point from our experience in Islington is you need your pioneers. You absolutely need your pioneers, and that's and all of those ingredients I think lead to having the right culture. So that would be our message and our kind of conversation with other local authorities about our experience. And I think if you've got that right culture, the model doesn't much matter. To be absolutely honest, you can make anything work. So that's the end of my presentation. I'm not sure I've done for time, but probably more than 7 minutes. So I apologise for that. And back to Sally.
Thanks, Candy, and also Chrissy Gregory is on the call. Thanks, Islington colleagues, for putting this together. Again, just really great to have Islington on board, a powerhouse authority for SLIP support in children's social care. So really drawing upon, Chrissy particularly and Candy's experience and dealing, of delivering this in the social care sector. They have been guiding DFE as much of DFE has been guiding them in terms of how this should be delivered. So a big thank you to Islington colleagues on that front. We have one last speaker who gets the wooden spoon, I'm afraid, because they have to go last. So Kellie is going to talk to us from Warrington. Hopefully, Kellie leaving a little bit of time to have a few minutes of discussion and questions if possible. But I'll hand over to you, Kellie. Thank you.
Thank you, Sally. Just to say, in terms of Warrington, we're very proud that we were successful in receiving the bid to become a SLIP partner, and we've been through our own improvement journey through social care following our 2009 inadequate judgment. And I just want to say that one of the strengths that we are really proud of in Warrington is the fact that partners always try to come together and work together to improve outcomes for children, young people and SEND. And sometimes that's the biggest part of the battle, is getting everybody on the same page. So not only are we committed to maintaining and developing the quality of our offer, but also reviewing the effectiveness of our services. And on this slide, I've just listed some of the things that we're very proud of. So the co-location of early years staff and health professionals, which is really supporting us to identify children's needs at the earliest opportunity through the ASQ questionnaires that health visitors do in conjunction with children's centre workers and nursery staff, as well as our graduated response. And we have a really strong committed to inclusion programme, where our minimum expectation is that, you know, every teacher is a teacher of a SEND pupil and every school is a SEND school. So we're not passporting responsibility on to other schools, and we've improved that programme year on year. We are also very proud of the fact that we are increasingly adopting experiential approaches to our service redesign and commissioning activity, such as the work that we've done around the neurodevelopment pathway and improving wait times for occupational therapy services as well. Next slide, please. Our offer, as a result, has been designed around what we consider to be our strengths, so that we can deploy people who are experts in that field into the other local areas and really work hand in glove with those authorities, so that we can help them to tackle what they consider to be their key challenges that they're experiencing. If we move to the next slide, please. Our approach, we have many different approaches, techniques, tactics that we employ. So we do offer peer audits of EHC assessments, plans and annual reviews, coaching and mentoring opportunities. We also can offer a traditional peer challenge model, go in and we've just done one recently, and look at a service and really work collaboratively to identify what areas they want us to look at and make some recommendations about how to improve, as well as other opportunities for us not to just go into them, but them to come to us and shadow and observe our own practice and see if they can pick up anything that way. And I think that recently we've done that around looking at the quality of EHC plans, and that was really, really beneficial, them looking at our plans and us looking at theirs. Next slide. So in terms of our expected outcomes, what we're trying to do is provide some impartial scrutiny and evaluation around the quality of practice and provide practical solutions to support that practice. We want ultimately all local authorities that we work with to have increased grip and oversight of their arrangements, so they can be assured that actually what they're putting in place is having the desired impact, and just make sure that relationships between partners, across partners, are purposeful and that everybody's on the same page. Just to say that, you know, to reiterate what the other slips have already said, that, you know, we are all on an improvement journey all of the time, and if we take our eye off that ball, then we are missing a trick, because once you make some improvements, there's always more to do, isn't there? And a key part of our work is to make sure that we are collaborative, that we are working across education, health and social care, as well as our parents and carers forum. Our SENDIAS are very important in terms of having their pulse on what's going on in Warrington, and also the experiences of children, young people with SEND. So those three things are vitally important, and that's the message that we always hope to convey to the partners that we will be working with through the SLIP programme. I'm going to finish there because I do want people to have opportunities to ask questions, so I'll put myself on mute now.
Thanks, Kelly. I really appreciate that. And just to say, we had a review meeting this week with an area that Warrington has just concluded a SLIP package with, and had some absolutely cracking, fantastic feedback about the work that Warrington has done with that particular local area. So it's been really heartening to hear that support has been so well received in an area that is in reasonably difficult circumstances themselves. I won't take any more time up. The only thing I wanted to just say as a quick conclusion from a DFE perspective, thank you for listening, everybody, today. If this kind of offer is an offer that that you're sitting there thinking this would be fantastic for us, this is exactly what we need, and we can commit to 40 days and the depth of work that would need to be done, please talk to your DFE case lead advisor. This is a DFE run programme at the moment in terms of selection of LAs. So please come to us, talk to us if this is the kind of work that you think you need in your area. Christine, are you going to chair as a 30-second discussion? Apologies for overrunning.
That's fine, Sally. They were such good presentations. Really interesting. Well done to everyone. Really good. I just had two people who'd had hands up that I'm going to come back to very quickly before we move on to our next session. So Crin Whelan, I think you were the first, and Anna Foreman. So if you still want to ask questions and you can do it quickly, then do come in now.
Hi, it's Crin Whelan. My question was answered in the chat actually, and it was about the rural SLIP. So thank you.
Excellent, good.
Hi,
Yes,
Christine,
right.
it's Sam from North Tyneside. Just again, very quickly, it was more, I didn't mean to put my hand up. I wanted to give a round of applause to the comment around every school is a school for pupils with SEND and every teacher is a teacher of SEND pupils. Love that, and I'd love to find out a bit more about how you've managed to do that, please.
Do you know, and you're absolutely right, that cheered me up as well. And actually what I was going to ask, but I can use chair's privileges, whether that's working well with your academies as well as your maintained schools, Kelly?
It is, absolutely. So we have a full Committed to Inclusion programme, regardless of status of school. We do not look at our schools through whether they're an academy, a free school or a maintained school. It's been in place for a number of years now, and it's grown from strength to strength. I'm just going to put my details because I've got my email address in there. So if you want further information, I can send some generic information about our CTI programme. Not all of our schools achieve it, and we have improved our oversight and grip on that programme. So initially in the first year, it was very tokenistic, but we have improved that. This year, the University of Chester have overseen the awarding of those of that certification. It is free. And that's also helped it be successful in terms of you can't buy your way to a certificate or a watermark, and you do have to be able to demonstrate a significant amount of practice around inclusion and the agenda. But more than, I think 86% of our schools achieved it last year. So a real strength, and this year we gave a commendation for excellent practice. So yeah, I'll leave my details and I'll share some generic information that we've got about our CTI programme.
That would be fantastic, Kelly. I think it's getting a really good response. So thank you very much. And thank you, Sally. I think it's been really good for you to come and share the programme and just the very different approaches that people are taking, that people can sort of tune into the bit, you know, in a sense that's working for them. I have no doubt that you will get a number of requests. So
thank you for having me.
You're very welcome. As delivery partners for DFE on a number of the programmes coming together, I am going to hand over to Amanda and Anna, who are going to talk to us about the What Works in SEND programme and where we've got to today. Amanda, Anna.
Thanks, Christine. And it's really exciting to be able to start talking about this in more detail. And some of you may felt we've been a bit quiet since we were awarded the contract back at the start of the financial year. But we have been very busy and we're now at the stage where we can start telling you about some of the busyness that we have been doing. So just a quick reminder of where the What Works in SEND programme sits within the RISE partnership. Hopefully some of you will have started now enjoying support through the RISE partnership and what we elegantly call Lot 1A, which is the support for local areas. That's kind of and what DFE called targeted support. So that's targeted support for local areas, and that's delivered by us and our partners at NDTI. And there is also, and Anna will talk much more about this, there's also Lot 1B, which is the training programme, and Anna's going to talk you through that on the workforce survey. But what I'm going to major on right now is Lot 2, which is actually the What Works in SEND programme. And it has been really exciting. We were really excited to get this contract, but actually what's been so nice has been realizing how excited everybody is about the fact of it. And I think for those of us who've worked in SEND for a long time and feel really passionate about improvement and getting the best for children and young people and families, actually starting to put some meat on the bones of what works, why it works and when it works, and really helping people to understand that, to support them on their improvement journey, just feels like you know, a great thing to be doing. Can you move on to the next slide, please? So just a reminder that when we talk about what works in SEND, we're not talking about individual child level interventions. We are talking about systems level structures. What are the right multi-agency partnerships? What are the things that you need to have in place that means that the structure which then delivers good services on the ground for children, young people and families. So just have that in your mind when you're thinking about sort of the contribution that you might be able to make. Now, I'm going to say that I can't actually read that slide, but you will get the sense that there is a cycle from practice to evidence. Yes, so we look at what the emerging practice is, what's going on in terms of what's coming out of looking at of our work in local areas. Then actually what we do is, and I'll be talking about the effective practice quality assurance framework, another snappy title for you. We feed that into that. We've got the research and evaluation strand for more in-depth quality evaluation, and then that builds into our established evidence base and feeds through to our website and what will be a really fantastic interactive hub. And then that enables us to think about, so you know, what we're doing at the moment is based on our current level of knowledge. So our hope is that, and our you know, I think it's more than a hope. Our expectation is that as we understand more of the granularity about what works, when and why, that actually we can be more, even more targeted and more purposeful in terms of the interventions and the help that we offer to local areas, and might be able to start kind of thinking about, you know, at the moment, you know, sometimes it's not always clear in terms of sequencing, you know, maybe should this intervention happen before that intervention. So I think, you know, be really helpful to understand more of that granularity and to take that cycle through, and hopefully that it will start to make more sense as I go through the rest of my slides. So what have we been doing? And I'm sorry, I don't think I actually properly spoke to the slide about the What Works in SEND programme. So our partners on that are Warwick University, It may seem strange to you that the key partner at Warwick is the business school, but that's because of the sort of systems and structure element and their understanding about change management and what makes what makes good leadership, what makes all of those sorts of elements are very much housed at the business school. But also partnering them from Warwick are CEDA, who many of you will know about, which is the sort of education research bit, and the medical school. So we have a really sort of strong partnership within Warwick working with us on the What Works programme. And then some of you may also have worked with ISOS Partnership in the past, so they're the other partners. So what has been, sorry, just go back for me. So what has been happening, already started, is the systematic literature review. So that's what Warwick are doing during the first year of the contract, is just making sure that whatever evidence is out there about what works in SEND is all pulled together, and we have a really comprehensive literature review that we can then build on as we move into qualitative research. So, and that's what the deep dives are. Warwick will do some deep dives around issues that we want to look at in SEND, and not completely determined yet, but likely that the first dive will be a look back at some of the interventions that happened on the DBOT programme that we were part of before, to help us understand what worked well about those interventions and what might be improved. And out of that understanding, we will be, it's not just going to be, I know sometimes academic papers can be a little bit dense and inaccessible. So we will be producing, Warwick will be producing accessible briefing papers, and we will be doing other kind of resources and things that build on them, so that it's not just sitting there as a paper, but actually there will be practice resources that help people understand then how to operationalise that in their own practice. Sorry, third time lucky, on to the next slide. So this is what is being included in that literature review that's currently ongoing. But we are absolutely clear that we want all of the evidence from everywhere. So we know that loads of services will have carried out, had independent evaluations done that might not be published. We know, for instance, that we've done evaluations for some of NHS England's pilots, which then don't, make it through NHS England Gateway. So if you've got something that you're able to share with us to put into the literature review which hasn't been published, or something maybe has been published but you know that it didn't have a very wide dissemination and might not get picked up through the normal kind of systematic review process, then please do send it in to us. And if we move on to the next slide, you can see, and I'll get if Marie or Adiba can put that email address. So that's Natalie, who's overseeing the systematic review. So yes, so any contributions that you would like to make to the systematic review, then please do email them to Natalie, and don't worry about overwhelming her. That is her job, and they are they are expert at sifting through multiple documents and pulling out what we need to do. So yeah, anything you've got, what we have to get past is a situation where we're kind of sticking a finger in the air and moving forward on the basis of what we think works. We just have to know. We have to really improve our evidence base, and that's what this programme is all about. On to the next slide, please. So that is the sort of the more formal, researchally kind of bit of it. But what we're also doing, this is the bit that ISOS are leading on, is developing an effective practice quality assurance framework. And if anyone can think of a shorter title that encapsulates those words, we would be intensely grateful. Otherwise, you'll end up with some very dodgy acronym. So what the framework will do, that when ISOS have built it, and they will be co-producing it, so there will be an opportunity for you to feed into what the framework looks like, is it will look at two elements. It will look at the strength of the evidence. So is it emerging? Is it kind of from feedback, just in the local areas? Is it promising? So is it, is there internal evidence in a small number of local SEND systems? And we think it's replicable, but actually whether or not it's fully adaptable hasn't yet been established. Then good. So we've got robust local and independent evaluations of approaches, and then we've got I say very robust, seems very robust to me. So that's at the stage where you've got academic or equivalent independent evaluation. So hopefully that gives you some sense. So then when you as a practitioner or as a commissioner might be looking to see, okay, so this looks like good practice over in this area, but how do I know? Then our sort of phone signal strength system will hopefully give you a sense of of what the level of evidence is about the practice. And obviously emerging doesn't mean that it's less good than robust. It just simply means that we at the moment have less evidence. So on to the next slide, please. The other thing that we'll be looking at is indicators of impact. So and we've got emerging, promising, good and robust, and that's based on how many of the areas that you've got evidence in. So lived experience of children, young people with SEND in their families, quantifiable education, health and wellbeing outcomes. Dogs have just seen a cat. Positive feedback from professionals working in the SEND system, and then is there evidence that the approach or elements of it could be replicated in other local areas? So that's in terms of the indicators of impact. So it's how many of those are we hitting before we can say how robust impact is. So that's the quality assurance framework. So basically the idea is that will act like a funnel. We'll have loads of evidence going into it, and then coming out of that we will be able then to grade what the level of evidence is, and then share that with you. So on to the next slide, please. So just going back to my point about, this is not about us, this is about all of us. There are loads of opportunities to be involved. So there will be an effective practice quality assurance panel. So in terms of identifying the signal strength on those two elements, we won't be doing that. We want to do that with you. So there will be an opportunity to express an interest in being on that panel, and all of the opportunities to get involved in the programme will be on the website. There will be an experts by experience group. The website, which I've just mentioned, is launching next week, so we're really excited about that. And apparently, I didn't know this could be a thing, but that's just showing my age. Apparently it has its own LinkedIn profile, which means that you could befriend it on LinkedIn now, and then you'll automatically get notified about it. Anna, who is way younger than me, will be able to tell you whether I was right or not when she takes over, although she's grimacing, so maybe she's not young enough.
More at the young comment, but I think what you said was right.
You just don't feel young because you've got a small child, and that's very aging. And this is slightly squashed, so it won't look squashed when you see it on the website, but this is a wireframe from the forthcoming aforementioned website. So that's going to be the home page, and then on the next slide you will be able to see, so that takes you into, there are going to be 3 sections. There's effective practice. So those are the things that are coming out of the effective practice quality assurance framework. And then there's research and evaluation. So, and within those, all of the evidence will be graded. And then there's the evidence store. And I think, is that about it for me, Anna? Have I got one more?
No, I think that's it.
Excellent. Right. So hopefully that sort of, gives you a sense of what we're aiming to do. And as I say, really excited and really pleased that there will be lots of opportunities for you to join with us, because to be honest, nothing we do is any good without you. Over to you, Anna.
Thanks, Amanda. And I can see lots of people saying they're keen to support. So I think initially we'll share the LinkedIn profile link, use that first, and then next week the website will be live and there'll be ways to engage with it there too. So yeah, website and LinkedIn initially, and we'll use events like these as the work progresses to share what the programme looks like.
Amanda, we just interrupt you? Can you just do a sentence on what the evidence store is? I think the sort of heading has thrown people a bit.
Sorry, that's so there are at the moment in our sort of in our test website, it's got documents. So it's kind of the documents that we know are helpful to people in terms of providing evidence about what works in SEND. So for instance, off the top of my head, I know that one of the documents in there will be These Are Our Children. So Christine's report on learning disability and autism and Tier 4. So, but obviously much wider than that. So sort of helpful background documents. But hopefully, if we've got it right, and I have every faith in the team leading on it, then the website will explain itself. So go and befriend it on LinkedIn and just, you know, get excited to see it.
We'll share the URL for the website with the slides and things that you get from this session. It will be live next week.
Thank you. I can feel the excitement, Anna. You can build on it now.
I can. Okay, so next slide, Mary, please. Amanda talked you through, like she said, the very glamorous lot numbers for the contract. That's as contractual as it's going to get, I promise. There is lots more excitement behind those lot numbers. So lot 1B, which Amanda mentioned, is actually a programme of national training. So CDC and the National Development Team for Inclusion, so the PFA team, lots of you will know are leading on that. So I'm going to talk to you about what that programme, the shape of the programme, but also how we have come up with the curriculum for that. And this is a previous slide, if you stick with that one, Mary, for now. It's an annual offer, so we have 6 months left in this contract year to deliver what you see there, but next year and the year after, because it's a very exciting 3-year contract, we'll be delivering this again. So important that you think about your needs around training, and those are your colleagues to feed them in. So we'll be delivering 50 virtual training sessions delivered via Teams. Those, I'll tell you what those are going to be on shortly, but we'll be developing 3 new training sessions, as well as probably running, because the needs that came through the survey, and we talk about some of the needs haven't changed from previous trainings that we've delivered. So we'll probably rerun some of our existing training too. 2 new e-learning modules, which will sit alongside our existing suite of e-learning. Again, we'll send you the link to where the existing modules are with all of the materials from this. 2 national events, so this being the first one and another in February. And then 2 webinars. So the webinars being an online, again via Teams, but a more focused session where you'll hear lots more from local areas, a bit like the SLIP element of today. So how local areas are doing things and really pulling out the sort of replicable elements of what they're doing so other areas can take that forward. But to get the curriculum for all of that, we ran over the summer, so next slide please, a workforce development survey. We asked some pretty broad questions. I guess we wanted to go wide and get as much intelligence as we could about what people felt the need for around training. So we asked, have you accessed CDC or partner support in the past, or are you new to us? And then based on the 5 themes that you see there, so legislation, co-production, systems, and we use systems to be a kind of catch-all for that interplay between health and local authorities, so the kind of multi-agency working aspect, but also picking up on some of the kind of really key roles, the DSCO role, the DCO. So that was all encapsulated in systems, processes and pathways, so thinking about pathways to support, pathways to services, the EHC process obviously, and data. And then we asked those who responded to rate their understanding and their ability to apply that understanding to their role. Next slide. So not quite as many responses as the green paper consultation, but that's not a surprise. But we were chuffed with that. So over 300, it was open for 6 weeks over the summer, so we were pretty chuffed, and it did what we needed it to do. This slide shows you, again in very small letters, but we will share the slides, the agencies that the respondents were from. Now education, again, this was self-reported, so I imagine education also covered those who work in local authority SEND teams, education teams, but we did actually get a lot of responses from schools, from some governors, not our usual audience and not necessarily the audience for the training that we are going to run, but still really important to understand what their needs are, because we're sharing this data with other partners, DFE funded contracts, NHS England contracts around support. So it's all really useful. But you know, local authority and health, the expected kind of majority of respondents too, and that was from all 9 regions as well. Next slide. And again, important so that we can pitch the training, we also asked people to tell us what their level of role. So strategic leaders, again, the usual kind of our usual audience for lots of our sessions like this. Training tends to be for practitioners, so it's nice to see that we got lots of practitioners there, and some newly qualified staff, or a couple of newly qualified staff trainees as well. Next slide. More important, what the data actually told us. So this is a list of suggested topics for, I'm going to say training, but actually not all of this is appropriate to be delivered in a training format. So we're certainly not going to address all of these points through this offer, but be reassured that a lot of the things here are what we actually do at local area level. So the other bit of our contract where we go into local areas and design and deliver kind of bespoke, discrete sessions and consultancy, a lot of the things that you see there are what we deliver. So these needs are being met in other ways, but we did get a sense of what we could deliver through that kind of national training format or national events or webinars. Lots coming through, and surprisingly, themes that we've heard today about, I suppose, worries about the move to integrated care systems and what that meant for SEND. Definitely something that we can pick up nationally as well as locally. Lots on data, and it was really exciting to hear what Bedford are doing around data, but really encouragingly, I think lots of people asking how we can use kind of experiential data or voice data to commission smarter and be more effective at commissioning based on need. And data is one of the things that we're picking up in the training offer. Lots around pathways and lots around kind of strategic co-production. So more than, as I suppose, how to do it strategically and hear from local areas who are doing it, a bit like what we heard from Islington. I think we want to see more of that. Next slide. Again, you will get these slides so you can kind of look deeper there. Some headlines. So we did, as ever, get a lot of requests, high demand for people to understand examples of practice and models. So links back to the What Works Centre, being able to describe what a model looks like and understand if it's, you know, what are the barriers and the enablers to the success of it. So we want to pull lots of that into the training as well, as we always do. But I'm reassuring to hear that that is what people find most helpful. Data, I think I've already said, was the theme that scored lowest across both knowledge and ability to apply it to the role. Social care, the social care practitioners who responded, they did request some really specific kind of role specific support around SEND. We find that actually often our multi-agency pitched training is helpful for our social care colleagues, but they do need some bespoke and specifically social care support as well. Like I said, the education professionals were the group who had accessed our or other partner supports the least previously. Again, they might not, what we deliver here might not be best pitched for them, but there are lots of other contracts out there and resources. I saw someone post an Autism Education Trust resource earlier in the chat. So we are going to signpost to where existing training that can meet some of those needs are, and we'll discuss with our partners. So there are a couple of other big DFE contracts that are delivering training, designing training that will be for that audience. So we'll pull that together and share it. Next slide, with a few minutes to go, but probably most importantly, what the offer until the end of March looks like. So the first webinar is on the 9th of November in the morning, and that's on joint commissioning, but that like really focusing on that kind of replicability and practice model. So I think 3, definitely possibly 4 areas sharing their joint commissioning journey. That word that I agree, Chris, isn't the best, but actually, and I suppose it talks back to Amanda's point about kind of emerging to robust. You know, we want to hear it all. It's not about areas that are doing something that are, you know, their journey is complete. It's about understanding where they are and how they've got to where they are. The next national event is in February. Oh, still previous slide. National event in February, strategic co-production and service design, commissioning and evaluation. But as Christine said, we'll make sure that the workshops talk to some of the practice that you've also heard about today. E-learning, 2 modules before the end of March, the first one pretty soon actually, on ordinarily or normally available provision. So we, and Philippa Stobbs, our colleague, wouldn't want us to say that that can't be taught in an e-learning module, but what that module will do is talk about the kind of principles of effective practice and draw on areas, what areas that are doing that well, how they've done that. We are able to do kind of bespoke local area work around ordinarily available provision through the other bits of our contract too. And then a second one on the Mental Capacity Act and Liberty Protection Safeguards, which came directly from the workforce survey as a really clear need. Next slide. And those 50 sessions that I talked about, which will be open to all to sign up to, delivered online, we'll be sharing how you do that very soon. So if you're here, you will have your email address, you'll get the details about that, share it with colleagues if it's not you who is best placed to attend. But there'll be one around pathways into post-16, which will be delivered by our PFA colleagues, one on social care, send and co-production, and one around commissioning data and voice. So those will be published soon and you'll be able to sign up. And they'll also be recorded like this. They'll sit on the Practice Hub once that website is launched too, so people can access them afterwards. I think that might be it for me. Yep.
Ooh, Anna's quick question for somebody who already wants to join the Joint Commissioning event. Can you just remind people how the setup works and how you're doing that works, please?
Yeah, so it'll be similar to having signed up for this today. I don't think the link is live yet, but as soon as it is, we'll send it out to everyone that was here so you can sign up.
Thank you very much. So there you go. A lot's going on, lots of good practice. I hope you are now feeling more energised than where you started. There is some good stuff out there. It's just always so good. And thanks for those who are pressing the clap button. Quite right too, and more. So what you now have is a 5 minutes. Marie's given you 5 minutes. She's very generous to go and have a comfort break. But the workshops will start at 12:05. So you should have had all your workshop links through Adiba. You should be signed up. It's a really, really good range of workshops. It's always so exciting to share the morning with you. So thank you all. Please fill in the evaluation survey. It helps us explain to the DFE why we have to keep running these. So that's always really good. And thank you for your kind comments in the chat. I hope your workshops go really well, and I look forward to seeing you all again soon. Take care. Bye.